Trying to figure out if you're pregnant before you even miss a period? You're not alone, and believe it or not, your body might already be sending you subtle signs, even during week 1. Hey everyone, I'm Sarah Jennings, host of the Mama Method for Ubi Health. As one of the AI faces of Ubi's global network of over 1,200 medical providers, and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to various issues around pregnancy, parenting, and family planning. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. So let's clear something up first. When doctors talk about being 1 week pregnant, they're not saying you've already conceived. It's actually counted from the first day of your last menstrual period. So week 1, technically, you're not pregnant yet. But that doesn't mean it's not an important time in your cycle, or that you might not feel a few interesting things happening in your body. Now here's where things get even more fascinating. Even during this pre-pregnancy week, some people say they start feeling off, and I can actually relate. When I was trying to conceive my twins, Hudson and Chrissy, I remember waking up one morning with this odd lower back ache and thinking, weird. At the time, I didn't connect it to my cycle, but now I know that relaxin, the hormone your body starts producing early to prep for pregnancy, can loosen ligaments and make you feel achy, especially in your lower back. Totally normal and doctor-reviewed info. Another one. Headaches. About 88% of women report having headaches early on in pregnancy. This can happen due to changes in hormone levels, especially estrogen and progesterone, and also hydration. Your body's already starting to demand more fluids, but if you're not drinking enough water, that can trigger tension headaches. Hydration became my personal obsession during my 3rd pregnancy. Can't go anywhere without my giant water bottle now. Next, breast tenderness. This was absolutely one of my early clues. I remember hugging Chrissy after daycare and wincing just a little. So sensitive. That tenderness? It's your body already gearing up for milk production, even this early in the game. The surge of hormones causes your breast tissue to swell and become more sensitive to touch. Now, let's talk bloating and gas. Yeah, the glamorous side of early pregnancy. I felt puffier than usual long before I tested positive with baby number 3 on the way. That's again because of hormone changes, particularly progesterone, which slows down digestion. The result? More gas, more bloating, even some constipation. So if your genes suddenly feel tight but your diet hasn't changed, that could be your body's early response to a possible pregnancy. And then there's light spotting, sometimes called implantation bleeding. This doesn't happen for everyone, and technically it's more common closer to weeks 2 or 3. But some women do notice a bit of pink or brown spotting around the time they'd expect their period, or slightly before. Totally harmless in most cases, but it can definitely catch you off guard if you're not expecting it. Nothing we're talking about here is a definite sign of pregnancy, but taken together, it's why so many people swear they just felt pregnant before the test ever turned pink. Wondering what you can actually do during this time? First, track your cycle. Knowing when you ovulate is key, especially if you're trying to conceive. And second, treat your body like it might be pregnant. That means staying hydrated, avoiding alcohol and smoking, starting a prenatal vitamin with folic acid, and getting good sleep. These steps aren't just helpful, they're doctor recommended and can improve your overall fertility and health. And hey, if you're experiencing symptoms and wondering what's going on, don't guess. Check in with our doctor-approved AI at ubihealth.com. The Ubi Symptom Checker is free, super smart, and feels like having a full medical team in your pocket 24/7. Need more content like this? Like and follow for more doctor-approved info you can trust, right here from Ubi Health.